And now, it's Boomer Life. Lifestyle discussion designed to make your life more engaging, meaningful, and complete. Celebrating the baby boomer generation, this is Boomer Life on CIL 650.
Welcome to Boomer Life. I'm Joanne Sutton, and on today's show, we're spending an hour with our friends from the Alzheimer's Society of British Columbia. Our efforts are to continue the conversation about the work of the Society and to focus on quality of life for families on the dementia journey who have connected with the Alzheimer's Society of BC. And if this is you, the most important message that we have is that you are not alone. Our guest on this portion of the program at this time is Maria Howard, who's been an essential part of every single show. Maria is the CEO of the Alzheimer's Society of BC. She is a dynamic and strategic thinker with both provincial and national board governance experience. Her decades of leadership in the healthcare sector and commitment to operational excellence fit with the Society's ambitious goals. Goals that have grown out of the increasing number of people who face a dementia diagnosis in this province. Maria lives in Vancouver with her husband and 2 kids, and she enjoys biking, swimming, and spending time with her many pets. I think you're spending time with pets today, aren't you, Maria?
Yeah, that's what it seems to be. Hi, Joanne.
Hi, and thank you for joining us. I've never actually asked you how many pets that you have.
Well, we have a dog and a bird and a lizard and a horse.
Oh, you got your hands full. So it's actually great to get to know a little bit more about you and all the work that you do for the Alzheimer's Society. Do you actually are there any statistics about the number of people in this province that suffer from Alzheimer's or some form of dementia?
We know that over 70,000 people in the province are impacted by dementia, and Alzheimer's is the most prevalent of types of dementia. It's a number that is growing just at an amazing rate, and we know that number will almost triple in 10 to 15 years if nothing is done to find a way to understand the cause and cure for Alzheimer's.
So the last episode, we talked with a number of people working to change this dementia journey through what we called dementia-friendly communities. And today, we're actually going to discuss a lot of the support services that are offered through the Alzheimer's Society of BC. And we'll also hear a couple of personal stories about the dementia journey. But before we begin, as always, we would like to remind listeners that there is a lot of information available on the website for the Alzheimer's Society of BC. Just go online to www.alzheimerbc.org. And Maria, this week I'm hoping that you can help guide us as we talk about First Link. And First Link is something that connects individuals and families affected by Alzheimer's disease or another dementia with a community of learning, services, and support. So can you explain this program to us a little bit?
First Link is a way that people and their families, people who've been diagnosed with Alzheimer's or another type of dementia, and their families and friends, their supports, can connect in with the Society and begin to get the help, the information, the support they need to really understand what is happening in their life. A diagnosis of Alzheimer's is just an amazing piece of information. People react very differently, but basically it is a showstopper at some point. And so to get information and support and begin to know how to make the best decisions so that your quality of life, that for the families, for friends, for the people with the diagnosis, they can continue to feel like there is hope to continue to move on. And actually that's the tagline of the Alzheimer's Society BC is help for today, hope for tomorrow. And while, we are hoping to find a cause and a cure for this disease, in the meantime, providing people with help today so that they can continue to make the best decisions, know where to turn, how to get help, how to maneuver the healthcare system is so important.
Mm-hmm. So it's kind of like the very first contact or the baby steps that someone needs to take after first receiving that diagnosis, but it could be the patient themselves or it could be the caregiver or the spouse as well that could benefit from First Link.
Yes, First Link is designed so that people can refer into the program, and typically, or actually I should say that the program started with healthcare professionals being the main audience of having physicians refer their patients to First Link, but that's been expanded so that anybody can refer a family member, a friend, they can refer themselves, and begin that first connection of information. And the whole point is to make it as easy as possible. Again, recognizing that people come to a situation so uniquely, and some people, the minute they hear this information or hear this news, they need to get help. Other people need to take a lot of time to think about it and feel comfortable or even confident to reach out and ask for help. So FirstLink is completely designed to be a very easy way for people to come to the society, ask for some information, and then we begin to proactively interact with that family and begin to help them in their own personal situation.
Excellent. So I understand that there have been some recent developments related to FirstLink. What can you tell us about a recent expansion of the program?
Well, FirstLink has been offered by the Society for quite a few years. It's been offered in a number of different locations throughout the province. But recently we have, through our partnership with the Ministry of Health, been able to secure more funding through the Ministry of Health. They've been very generous so that we can actually roll FirstLink across the province. So now not only will it be in certain locations, we will be able to expand it across the program or across the province so that all British Columbians can reach out to FirstLink and begin to get the help. So one of the big first steps we've taken is by opening up an office in the Surrey location, the Surrey region, for the Southeast Fraser, which is a very big part of the lower mainland of BC, and begin to have an office that steps into that community, reaching from Surrey all the way out to Hope.
Throughout the entire Fraser Valley.
Just about, yeah. It's a large area, and it's a growing area. And we know that a lot of people, might live in one area, but their physician might be somewhere else. Their family might live somewhere else. So we need to be able to have the services reach out to all boundaries of the province so people can get the help.
Well, it's wonderful. So that in the instance that the people don't have to come to you and travel great distances to your resource center in Vancouver, that you're actually taking your services to the people.
Absolutely. The FirstLink, people can actually access FirstLink through, there's a FirstLink Dementia Helpline, or there is our website, and they can go through those 2 points to begin the first contact. But the supports and the services, the programs, the support groups, the education sessions are done in a number of different modalities in a number of different communities. So we really, again, are trying to take the services to the community level where people are living and have a number of supports and become a part of that so we can gradually support people to remain in the community. We can work very closely with the healthcare professionals, the physicians, to refer their patients to get help, to actually provide training to healthcare workers so that they can better understand how to just increase the experience of working with someone with dementia. So FirstLink is provincial, but the support and services that sit under FirstLink are all community-based because that's really where it's so important to be.
And do we have the toll-free phone number for the FirstLink Dementia Helpline?
We do. It's 1-800-936-6033.
Excellent. Now, also in today's show, we're looking forward to hearing from our guest, David Brown. He's a community member who has accessed support services through the Alzheimer's Society of BC, and we're going to be hearing from David shortly. But, Maria, what can you share with us about his story?
David brings a very personal story about his journey. He has been a very successful professional in his life, being in Alberta and coming to BC, and then eventually receiving a diagnosis of Alzheimer's, which I know he will share. What David's story also says is that David is a unique individual with his own unique story. And that is really important to remember because while we do talk about, what are the typical symptoms or the common symptoms that people might experience when they have Alzheimer's, everybody comes with their own personal experiences and beliefs, and that makes everybody's journey different. And also with Alzheimer's, people do tend to progress through the disease at their own level. So whereas some people may have significant memory deficits, other people may have more deficits around language or executive functioning. So everybody has their own story, and so it's really important, and it's wonderful for people like David to share his story because what we're hoping to do is to encourage people to feel feel safe and trusting to reach out and get help, and recognizing their own personal experience is unique. And by getting information, they can make decisions that fits their own situation the best for them and their family.
Oh, excellent. We have learned over time that Alzheimer's is not a cookie cutter disease. And like you mentioned, every person brings a different story and a different journey to the table. Also on today's show, we're lucky to have Michelle McCabe join us from the Vancouver Resource Centre with the BC Alzheimer's Society. Michelle is going to be able to discuss the various different ways in which families across the province can actually connect to the Society through the First Link program. Finally, this hour, we're going to meet a special lady, Marion Lowry, who is a committed fundraiser for the Society. We're going to learn about her reasons for supporting the Alzheimer's Society and some of the upcoming events that she's going to be participating in to help raise funds and awareness of Alzheimer's disease and other dementias. So can you remind us, Maria, why the fundraising work of Marion and others like her is so vital to what you do?
Yes, people like Marion are such wonderful supports of the Society. Fundraising is critical. While we do have a great partnership with the Ministry of Health for funding around First Link, the majority of the funding that comes into our Society is through donors and events. And so the fundraising efforts through our many events during the year is really critical so that we can continue to offer programs and services across the province, as well as supporting our dementia-friendly communities. It's also a way to reach out to people and to raise awareness. It's a safe way for many people to come and start to learn about Alzheimer's and dementia, and while at the same time beginning to understand better about the services the Society can support, and while reaching out in your community is a good way to begin actually to understand one's journey.
Excellent. Thank you, Maria. Once again, if you want more information about the topics we're discussing, please go to the website, alzheimerbc.org. And we've got a lot more to cover in the next hour on Boomer Life. Maria Howard, we've been speaking with, is the CEO of the Alzheimer's Society of BC. And the dementia journey continues when we get to meet David Brown. That's next on CL 650.
Celebrating the baby boomer lifestyle. This is Boomer Life on CL 650.